All right, good afternoon, and it's great to be here in St. Louis at WashU today. Had a great meeting prior to coming in here today to talk about WashU and all the things they've been doing. How grateful I am as governor of the state of Missouri to have this institution in our state. And before we talk more about the new test developed by WashU, I want to give a quick update on COVID-19 cases here in Missouri. We continue to see a trend in positive cases among college-age students as many return to school. We are closely monitoring the impact of 18 to 24-year-olds and are having on our overall case growth and increase the positive rate. In some Missouri college communities, positivity rates have soared as high as 45% in one day, just among the 18 to 24 population. Through August alone, nearly 7,000 individuals in the age range have tested positive. As of late, approximately 30% of the new cases have been among this age group. Again, while young, healthy people are likely to have mild symptoms and quick recoveries, that they may unknowingly carry COVID-19 to someone older or with underlying conditions who is unable to fight off the virus. This is why it is so important for young people to take precautions and understand the responsibility they have in the health of their communities. Although more young people continue to test positive, the vast majority of these are not hospitalized. Our weekly infectious disease calls, which we have done now for over 5 months, indicate that we have had no students admitted to the hospital at the University of Missouri. They also are seeing less older and at-risk individuals getting sick, which is a good sign. I know there is a lot of concern right now regarding college students, but I want to assure you that our colleges and our universities have plans in place and are taking all steps necessary to keep their students and communities as safe as possible. From a statewide perspective, things continue to look better, especially as our economic and unemployment numbers improve. Overall, our healthcare system will remain below capacity, and our fatality rate declined significantly. Matter of fact, in April and May, it was at 7%. As of August, it was 0.6%. However, to know that every day is still a concern for me and many other people that are dealing with this virus, which is why it is so important that we continue to social distance, wear a mask, and wash your hands. These are still the most important steps we can take, especially with flu season approaching. As you know, we received great news last week with the FDA's approval of a new saliva-based test developed by researchers here at Washington University. Throughout COVID-19, we have worked hard to significantly increase testing across the state. By increasing testing volumes from only a few thousand in a week to nearly 100,000 per week prior to this approval of this test. By enabling rapid testing of large numbers of people, this new saliva test is a major development that will improve our testing capabilities even more. I want to thank WashU and all the researchers, not only for their work on this new test, but also their continued support throughout the COVID-19 crisis. WashU has played a critical role in our efforts to expanding testing. They have also played a critical role from day one on moving this state forward by helping the state with data, with research, with information, and they continue to do that. One of the things we talked about in the room just a little earlier was, and I was so proud as the chancellor, the vice chancellor, and some of the doctors in there, that this university didn't wait for somebody else to come up with solutions. They took it upon themselves to say there is nobody out there that can do it any better than we can do it. And they set their people to work, just like we had to do as an entire state. When this whole pandemic started, there wasn't no experts out there that had all the right answers. And I commend them for stepping forward here in Missouri and leading the way in our state to help with this. They have also participated in our weekly infectious disease panels every Saturday morning that we are grateful for their expertise and their assistance during these challenging times. And today I would like to ask Dr. Jeff Milbrandt, Professor of Genetics and Director of the McDonald-Gemone Institution, to share some details. Doctor?
Thanks, Governor. Thank you, Governor, and thank you all for being here. We developed a new test. As you know, viral testing is key to helping control the pandemic, and it's been in limited supply since the beginning of the crisis. To expand our ability to find coronavirus infection within our own university, within the residents of St. Louis and the residents of Missouri, we at the McDonald Genome Center, a team led by Rich Head, as well as many, many people all throughout the medical campus, strived to develop a new test. And I'm happy to report today that we were successful and that culminated then in the emergency use authorization of this new saliva-based test with our corporate partner, Fluidigm Corporation. We greatly appreciate the support of the governor and Senator Blunt, as well as all of our community donors, Community St. Louis donors who helped us achieve our goal. And it's been said several times, but it bears repeating that the infrastructure and the NIH support of the Genome Institute, as well as all of Washington University, has led to the possibility that we have the expertise and the infrastructure to rapidly pivot and contribute to the coronavirus pandemic. So the test itself requires this. So if any of you have had an NP swab or seen someone have it or seen a movie of it, you realize that spitting into this little funnel and this little tube would be much easier. So the test requires only a small amount of saliva collected by spitting into this tube. It is very accurate. It is quick, simple, and is not limited by supply chain shortages that we've seen in others. It's also very economical. Importantly, this saliva test can be altered in the future to accommodate other viruses, such as the influenza viruses that will soon raise their head amongst our population. So this saliva test was approved only last week, so some of the details are still being worked out. However, this highly accurate test will greatly expand testing capacity within St. Louis and within the state of Missouri, allowing for repetitive testing and rapid identification of disease outbreaks. This will allow us to return to school, help return to school more safely, help to return to work more safely, and help us identify outbreaks in our most vulnerable populations at a very early stage. We are now working with the state of Missouri to make the test more broadly available to all of our residents. Thank you.
Thank you, Doctor. I've also got Director Dixon's here with me today, also Director Richardson's here today to also give you a little update on the economy, a little give you an update on some of the testing, some of the things we're going on. So, Todd, why don't you come on up, give them a little briefing on what's going on your...
Thanks, Governor, and thanks, Chancellor, to you and to Dr. Milibrandt for hosting us today. We're really excited to be here as a part of the continued collaboration, as the Governor mentioned, between the state and Washington University from the very early days of this pandemic. We've worked with researchers, with experts across a range of disciplines, with a range of expertise to really inform and refine the state's response, and we're proud of that collaboration, and we thank you for it. You know, testing has been and remains a key pillar of the state's COVID response. From those early days in the spring, as the Governor mentioned, when we were testing just a few hundred Missourians a day, to today where we're routinely testing 10,000 to 15,000 Missourians a day, we've made tremendous progress. To date, there have been over 1.3 million molecular PCR tests conducted in Missouri, and that's tremendous progress from where we have been. We've been working constantly to expand that testing availability over the last several months, and we'll continue to do so in the coming weeks. We've also focused on getting those tests where they have been needed most. We've conducted more than 150,000 tests in long-term care facilities across our state, tens of thousands of tests conducted in congregate care settings in our state, and community sampling events that have been conducted in nearly every corner of our state. We've also been working to distribute testing supplies and PPE to local government and to our healthcare partners. We also have been excited to explore innovative ways to use our testing technology, including using wastewater sampling to give us an early warning detection system in some of our state's prisons. But we're really excited today to be here to support the work that Washington University has done on this new test. And as Dr. Milibrandt mentioned, the state was really fortunate to be engaged in this conversation with WashU going back to the early part of June. We've been really excited to follow those developments and to talk not just about how we make the test a reality for the St. Louis region, but as Dr. Milibrandt mentioned, to make it a reality for the entire state. So in the coming weeks, we'll be working to not only help make the test that's going to be run here at Washington University available to Missouri citizens, but also to hopefully make that technology and that development available to other parts of the states as well.
Thank you, Todd. Thank you, Todd. I appreciate everything you've done. So many people had to do so many different things than what they originally come to work for, much like I heard some of the university experts say. Nobody was exactly dependent exactly what we were going to do back in January and February, how much it changed. And I want to commend Todd for taking on a whole new role of being part of the solution to this and to a very demanding job to do that. Next up, Director Dixon will be here today. And I just want to say this about Director Dixon. About 30 minutes into 30 days into the virus as we move through the state, one of the things we had to do is start looking, how are we going to recover the economy? Knowing we were in the middle of a virus, neither was in a pandemic, what were we going to do? Kept thinking down the road, what was the solution we had to do? He was one of the ones I called in the office early on, and I remember we had to develop that. The other thing that I learned during this entire pandemic is something I hope I'm never in the situation again, and I hope Missouri is never in that situation, no matter who the governor is. The one thing I did realize is how dependent we were on other people outside the state of Missouri. Whether that was countries trying to get supplies, whether that was other states that were fighting for the same supplies we did. And frankly, he was trying to figure out how we're going to meet the demands of the Missourians for what they needed, the healthcare industry, in such a trying time. And one of the things that Director Dixon did is I reached out to him and I said, look, reach out to manufacturing companies in Missouri. Find out if they're out there. Find out if they would be willing to retool their entire companies to help us make PPE gear across the state of Missouri. I didn't know whether 5 people would respond to that, whether 100 people would respond to that, who it was. 200 companies in this state responded to that. Again, going back with what I said about WashU, Missourians taking care of Missourians. And I think that was one of the proudest moments that this whole pandemic that I know people were willing to change their entire companies, their livelihoods, and their employees to help all of us that are in this room today. So, Director Dixon.
Thank you, Governor. I'm Rob Dixon, the Director of the Missouri Department of Economic Development. You know, we say that public health and the economic impact of the pandemic are two sides of the same coin, and certainly what we're here discussing today, I think, demonstrates that. You could see the impact of the pandemic on the economy in the lives of Missourians every single day, and that's why, as you just heard, Governor Parson directed the entire administration to develop an economic recovery strategy, and as we've seen and still see every day, it's working for Missouri citizens. Our focus has been on helping Missouri's businesses, communities, and citizens recover from both the public health and the economic impact of the pandemic. We've strategically targeted resources for workers who have lost their jobs, small businesses, tourism, food production, nonprofit organizations, broadband internet expansion, and of course, as the governor just mentioned, PPE and medical equipment production, among many others. These resources have all been made publicly available on the state's Show Me Strong Recovery website and would certainly direct interested folks and their businesses to that set of resources. But behind every application, behind every story, of course, there's real people, there's real businesses, nonprofit leaders who are trying to grapple with the challenges brought forward by the COVID-19 pandemic. And innovation and research and tests like we're here talking about today certainly make it easier for businesses to test their workforce, as Dr. Milbrand mentioned, to get back to work sooner, for students to get back to school faster, and certainly overall to help us control and slow the spread of the virus. That's why our team at the Department of Economic Development and across the entire administration is certainly excited to work alongside Washington University and their business partners, especially to help scale up and expand the production of the raw materials and suppliers for the equipment. For example, we're currently working with a company in the region who can help supply those specialized funnels needed for this type of testing. Of course, it's going to help us expand these resources across the entire state. We will continue to work with Washington University, who is an outstanding economic engine for our entire state in its own right, and we could not be more proud to have this partnership with them. Thank you so much. Governor?
Thank you, Rob. Next up, he normally is not with me on these daily press briefings that we do or weekly press briefings we do, but Senator Blunt's here with us today. Been able to travel around the state with him on various issues. I've learned a great deal with him about research in the last just couple of days that I didn't know. I learned just a while ago from the chancellor about what Washington University does to this what it does for this community, but more importantly, what they do for the state. When you talk about $1 billion worth of research a year right here in this committee, that is one thing we ought to take out of this meeting today and realize how important that is, and to be able to do that for the state of Missouri. Not only for Missouri, but for the entire country. It wouldn't be possible. It wouldn't be possible without Senator Blunt's dedication to research. Long before COVID-19 ever got here, that money that was coming from the federal government to do the research in our state has paid off even more than the day that fund was here years ago, because how it's helped us to fight this virus and how to do a COVID-19. So, Senator Blunt, appreciate you being here today.
Well, thank you, Governor. Great to be here with you. As many of you know, research has been one of my priorities since I started chairing the committee that funds health and education and labor. 5 years ago when I started chairing that committee, there had been no research increase at NIH for a decade. And the buying power of our research dollars was about 22% below where it had been 10 years earlier. Young researchers were leaving the field because they just weren't getting the grants in that highly competitive, constantly restrictive environment. But we've changed that. We're 40% higher in our research funding than we were 5 years ago. Certainly in our state, the University of Missouri, in the vaccine area, St. Louis University has always been a leader, but nationally, at the very top leadership levels of research is Washington University. The fourth highest recipient of federal research dollars in America is Washington University. The chancellor told me on the phone just about 90 days ago I should begin to start thinking before long I'm going to be saying the third highest research university, and they are quickly closing in on and maybe the second and maybe the first, but $500 million, $500 million comes to this campus every year from the federal government, matched by another $500 million from university resources, from individual gifts that make that all happen. Everything from Alzheimer's research to microbial research and lots of space in between. But as the governor's pointed out today, and we've been talking about today, clearly having the infrastructure, the clinical facilities, the infrastructure facilities to look at a challenge and see how to meet that challenge. We heard not only good information today on testing, but also on the vaccine itself, where I think the university is heading toward a very unique spot on a vaccine that they would be developing here that would be an additional vaccine. Remember, we're going to have a handful of vaccines in all likelihood available to the country. None of them will be the same as the other 4, or there wouldn't be 5 different efforts being made right now to get a vaccine. Actually, at this moment, in something that Senator Alexander from Tennessee and I started calling the Shark Tank for testing and Warp Speed for vaccines. I think the federal government's decided on the vaccine front at this moment we're investing in about 8 different vaccines. Some of them already started producing the vaccine itself. And one thing that we really need to be sure we're projecting in this discussion is vaccines that are available to people that get through the FDA process will be as safe as any vaccines have ever been. The risk the government is taking is not a risk in the vaccine itself, but a risk that we'll financially support vaccines that won't be approved. Let's say we're supporting 8 right now. They will be, some of them in progress in the process of producing the vaccine already. Others we would hope to be soon in the process of producing a vaccine. But if at the end of the process only 4 of them make it, that means the 4 that made it will have vaccine available in all likelihood. At the same time, they're certified by the FDA. That doesn't begin a 4-month production process. It occurs sort of as the 4-month production process is ongoing. The risk the government would take would not be a risk in the vaccines that make it, but at some point we may have 4 that didn't make it, and at that point we'll be a financial partner that allows those vaccines to never go to any individual and just be taken off the board. But by then we will have invested $5 trillion in all likelihood in our effort to fight the virus and save the economy. In a $5 trillion fight, if it cost $5 billion to have vaccines available in mid-January that otherwise would have been available in mid-May, that would be the greatest bargain in this whole effort. Universities had some experience with the testing on the Shark Tank idea that we came up with. But the test that was described here today, like other point of service tests that you're also working on, would be tests that would give you an answer quickly. The president's had some criticism for saying, well, the test doesn't really do any good. And to some extent, he's right if it's a test that you get the results on, as it happened too many times 5 or 6 days later. That becomes a data point. It does some good in knowing what the data is. It didn't do any good in fighting the virus. We need a test that we can get an answer on quickly so the person that comes back positive can alter their behavior. If you've been out for 5 or 6 days doing what you would have been doing otherwise, you're not helped by having taken that test, nor was anybody you came into contact helped by taking that test. That's why this kind of quick response test, hopefully with a response that can go quickly back to the individual that took the test, just like a point of service test. We want a test that's easy to take, quickly responded, you get a quick response, and doesn't cost very much. And we're going to need these tests for some time after vaccines are available. It will take some time after we have a vaccine for everybody who wants the vaccine to get the shot, to get the vaccine. Some of these vaccines even are double dose vaccines, so you have to get the vaccine twice. But between now and the end of that whole vaccine process, at which point we probably would have a herd immunity kind of set in at that point. Between now and then, we need to have testing that lets people get back to school, back to work, back to child care, and it needs to be exactly the kind of test that we were talking about here today. And, I asked the Center for Disease Control at a public hearing last month for a plan how to distribute vaccines. I was initially saying I'd like that plan by the end of September. They're now saying they're going to have a plan by the end of November. My point was, we need to have a plan to distribute the vaccines long before we have the vaccines ready to distribute. I don't want you to wait until January or whatever the date is there's a vaccine to come back with a plan that I can look at and the whole country can look at to see if this makes sense. The other plan we've asked for is a plan to talk about how that vaccine would be allocated. We don't want a vaccine that the only people that can get it are people that are able to drive hundreds of miles and spend hundreds of dollars. That's not the kind of allocation we want, and we'll have that available to talk about in the near future as well. But I know the governor and his staff have been asked to come up with a distribution plan for our state. I look forward to that plan being available sometime before the 1st of November, just like the national plan needs to be available before the 1st of November. I'm told now I can ask you to ask me any questions, and then we'll go back and reverse through the group here. Have any federal questions you want to talk about, or NIH or vaccine or testing questions while I'm here? Yes, sir.
You talked about the importance to Missouri. Will all this technology, all this information be distributed to every state around the country as well?
I'm sure it will. I'm sure it will. And you know, you've got going to have private sector partners on this that will.
So the test will be. I'm sorry, can you go to the mic?
Come on over and.
So the test that we developed is with Fluidigm Corporation. That's an international corporation. They, of course, are a for-profit institution, and they are trying desperately to deliver instrumentation as well as the test kits around the country and around the world.
And that would be the case with all of the NIH and federally funded information that's being sought at lots of research institutions. But you know, they're going to have their own partners, and their own partners looking at ways to make this available. That's why the distribution plan becomes important and the allocation plan becomes important. And as much as we'd like to think the allocation will be all Missourians get their vaccine first, it's not going to work out that way. But the same Missourians that will be at the top of the list would be at the top of the list in other places as well. I'm assuming that's likely to be healthcare providers. It's likely to be people that are working in nursing homes. But I haven't seen that list yet, but we're asking for that. And there is a group of ethicists that the National Institute of Health is working with to come up with that priority, as well as a distribution plan that needs to make sense.
Senator, do you think the date that was given by the CDC is November 1st? Do you think that's a legitimate date to shoot for making these plans? And do you think there's any connection to the election 2 days later?
No, I don't. And I would have rather had a date even earlier than that. And I think to some extent, if you look back at the hearing we had on this, we've been driving them toward having a public plan sooner rather than later. I would have rather had October 1st, but I'm going to accept November the 1st. I don't think that necessarily means there'll be a vaccine by November 1st, but it would be foolish to wait to have a distribution plan until a vaccine had been approved. The other thing that would be foolish is if we find out that there are 4 elements necessary to take the vaccine, and we've only got 3 of them. I said at that hearing, I said, look, if we find out when there's a vaccine available that you need the vaccine itself, the vial it goes in, a needle to take the shot if it's a shot, and something else that's part of that package, and you've only got 3 of those 4 things, I will be outraged, and the country will too. We want a plan. We want a plan that ensures that all of the necessary elements are there. We can't spend all this time and effort to try to develop tests that work and vaccines that work, only to find out that we had no plan as to how to distribute that, and no plan to be sure that all of the elements were going to be available.
All right, thank you, Senator.
Okay? Thank you.
All right, Director Dixon, anybody have questions for Director Dixon?
As far as the economic impact in Missouri, I understand some of this will be produced, manufactured in Missouri. Can you talk a little bit about that?
Sure. Yeah, obviously, working with Washington University and their business partners and Dr. Milbrandt, I want to address some of that. We look at this from a couple of perspectives, and as I mentioned earlier, one of the items that the governor outlined in our overall economic recovery strategy included a PPE and medical equipment manufacturing grant program. So we're looking at the opportunity to use that. We're also looking at, of course, if there's any job creation that would be created in the private sector, if there's anything that the state could do to assist on that. I would just say none of that has been committed or confirmed yet. Obviously, there are still many details yet that we're working through, but the state, as the governor mentioned, stands ready to assist, and that's why we're here today, and we'll continue the partnership. Dr. Milbrandt, anything on the business partnership?
Only to say that we've tried to use local companies for many things. So the funnel here is designed and generated by a plastic molding company in North St. Louis. And then the kits that we form, those are also all assembled by a small company here in St. Louis. So we've tried to, the Fluidigm Corporation kits, of course, are made in California where the corporation is located. But all of the things that go into the testing besides that kit and instrument, we're trying to make here in Missouri.
You talked earlier about how accurate this test was. Do you have the numbers on that compared to the testing that is in place now?
It's highly accurate. So when we sent in our application to the FDA for our emergency use, you have to do 68 specimens. So you compare to the gold standard test, which was the NP test that had been out there for 6 months or so. And so we were 100% concordant. So we had the same number of positives, the same number of negatives. It was 100%. It won't stay 100% as you do tens of thousands. You're going to miss some. But we're continuing with a prospective study that will have thousands and thousands of individuals, and we'll get a much more accurate representation of what the sensitivity and specificity are for individuals.
Hey, doctor, you said that this is a rapid test. What's the time frame to get a result back? You said rapid. Obviously, right now we're waiting 3 days sometimes to get another result back.
We hope that we will always be able to give a result in about 24 hours. If the capacity, if the demand becomes very, very high, that could lag until we get more pipelines and more instruments in place. But right now, we think we'll have the capacity to do 20,000 to 30,000 tests a week with the current pipelines and personnel that we have now.
Is there a different type of device or machine that is used to test the saliva compared to the nose swab?
Yes.
And
Yes.
so does that mean that places around the country, even here in Missouri, is going to have to order those type of machines?
Some places that want to set up this testing will order those machines. We have those. This comes back to the fact that the infrastructure at the Genome Institute has been supported for many years with the NIH. We had those machines in-house. We have an agreement to get more of them from the company, but others will have to purchase them.
All right, thank you, doctor. Director Richardson. Hi, I'm Michelle with Census.
Hi, Michelle.
I understand that CMS has issued new testing requirements for federally licensed nursing homes.
Yep.
I'm expecting that will lead to an increased demand on testing. So I'm just wondering how the state is prepared for that.
Yeah, it will be a huge increase in the demands for testing. As I mentioned, testing in long-term care facilities, both of residents and staff, has been a priority since the very beginning because we know that comprises some of the most vulnerable population that we have. We're appreciative of the support we've had to date from our federal partners, including the shipping of antigen machines that do antigen-based testing to the licensed skilled nursing facilities in our state. We need to get more supply of those kits to really make that as useful a tool as it can be. But the state is working very closely with the Nursing Home Association and individual nursing homes to make sure they have access to the testing they need. But it's going to be a significant increase in the volume and demand on testing, which is why we're so excited to continue to work with our partners like WashU, not only to make the test a reality, but also to make it available from a practical standpoint to be deployed into the field. So it's one of those additional tools that we think could be thrown into the fight there.
So those testing kits you're talking about that you need to increase, is that the responsibility of the nursing homes to try to purchase those, or will there be funding available?
Yeah, there is funding, and the state's made significant funding available to skilled nursing facilities. The federal government has directly made significant funding available for the purchase of testing supplies and testing services. So I think the resources will be there. It's all a matter of making sure that we have enough supply to meet the demand.
All right, thank you, Todd.
Yep.
Governor Parks, he has time for about 2 to 3 questions, then we've got to go.
Governor, I'm asking for a colleague, could you walk us through the decision to pay the McChrystal Group with the CARES Act funding, just after saying the Missouri Foundation for Health?
Yeah, it was one of the things we did early on, as we've talked all day when we started dealing with this virus. Nobody knew what to do, how you was going to be able to handle it, and what resources we had. The one thing I think, just what the chancellor said back there, I realized right away, there wasn't no outside group that's going to have all the answers to what was going on in Missouri. So we brought them in very early. Once we realized that we were trying to really do what we could for every part of the state of Missouri. If you remember when the virus first started, we were trying to figure out where to put resources in the state of Missouri. We didn't know whether it was going to be a statewide effect, everybody's going to be affected the same way or not, whether it was going to be in the urban areas, whether it was going to be in the rural areas, small towns, big towns. And then once we started getting the data, which they helped provide, to whether it affected the African-American community more than others, than it should have, that we needed to move our mobile testing sites, more of them into St. Louis, and pull them out from other regions of the state, we started seeing a pattern of how we were going to deal with the virus. I think their input, and when we thought the healthcare system would be totally overloaded, and we all thought that, I mean, everybody was writing about that, kind of the worst case scenario, we were able to put together to where we wanted hospitals at if we had an overflow situation. At one point, we were out there looking at dorms. We looked at the Dome here in St. Louis. We looked at Arrowhead Stadium. We looked at how bad was it going to be. But finally, when we got those people in to really give us a dashboard, to build our dashboard for Missouri, we realized the first place we was going to need it was St. Louis. And we were able to contact the Corps of Engineers. We were able to take the National Guard and put them together and build a facility in 11 days with that kind of data that was driven. How we were going to handle schools. Where was this going to affect us in the future? So, I mean, they've been very valuable. I'm thankful for the Health Foundation for helping pay for a portion of that. But I think it's been pretty clear because I mean, there's been some in the media is trying to make it sound like Missourians are paying that bill. Well, we're not. There's not been one tax dollar of the Missourians that have paid for that. It's all been through the CARES Act, and it was all through the Healthcare Foundation. And if anything, I'm just proud of the resources they had at hand to help us to fight the virus every day, and to consider that they pulled a dashboard for all the healthcare hospitals in the state together where we could share information to the public. Well, at the time was very, very valuable. In July, I'll go on with that. In July, we had the discussion whether to allow that contract to expire or not. I didn't. I was the one personally in the meeting that day and says, wait a minute, I don't want to do that. We got schools starting. We got universities starting. We still need to be able to figure out how we're going to deal with this virus because it changes every day. So having outside resources to come in and to help us through this was probably one of the better things we'd done at the time, bringing that in. And not only that, they put every state agency together to build our resources together, how to fight this and to help Missourians all over this. So I know there's been a lot in the paper and the media try to make a deal out of it and make it into politics. But I'm telling you, when you're delivering Remdesivir at 2 or 3 o'clock in the morning because you know where to deliver it to, and to be able to get that out there with the National Guard, the Highway Patrol, those decisions are critical, and consider in a 6-month period of time. So, you know, that's the real story behind the McChrystal Group.
Emily, Governor Parson, I'm switching gears on you.
Okay.
Session.
Yes.
Obviously, this morning, the Senate went until 3 a.m. and they threw concurrent jurisdiction in there.
Sure.
Just yesterday. Can you kind of tell me your opinion about how the Senate did, and now, what about House leaders? Are you hearing if they're actually going to take up concurrent jurisdiction?
Look, I'm very supportive of that special session. Look, the reality of what we should all be focusing on is the violent crime here in St. Louis and Kansas City. Not this, there's other problems across the state with violent crime, but we're talking about people committing murders every day in a larger scale than it's ever happened. If we don't give law enforcement all the tools they need to fight this, to be able to do it, I think if there's ever a time to do it, now's the time to do it. It's why I called special session. The jurisdiction has got into another political issue, but the bottom line is this. If you don't have the resources, you don't have the availability to try homicide cases, then it's okay if somebody comes in and help. if anything that we all should learn out of this virus, all of us was reaching to try to figure out who can help in tough situations. I think St. Louis is at a critical stage where there needs to be a little help there. The only way the Attorney General could come in is if the local authorities would ask him to come in. There's no way we're coming in here without somebody in St. Louis wanting us to come in here, i.e. law enforcement in this case. But there's a lot of homicide cases out there. There's nothing wrong with saying, hey, I need a little help to go out there and take murderers off the street. That's what special session was about.
Okay, this will be the last question.
Are you saying that the Attorney General won't come in unless Kim Gardner asks him to?
No, law enforcement. Law enforcement in the legislation, there's a tool in place for the local authorities to be able to ask for the AG to come in. Otherwise, he doesn't come in.
But in what we're talking about at the state level now is, to some, it seems hypocritical to say the local government knows best on masks, but the state knows best when it comes to prosecuting cases in St. Louis where they just overwhelmingly reelected Kim Gardner.
No, that's not true at all. It's the local decision to ask for that help. Again, I want to be clear to you with that. It's law enforcement is the one's going to have to ask for that. So it's going to be a local decision again. Look, this is an unusual time on the homicide rate. You know what the homicide rate is here, and people are dying, kids are dying and everything. We ought to do everything we can to make sure and take murderers off the street. And I'm going to do everything I can to do that. I'm going to do everything I can to support law enforcement in these times and the citizens of this state and this city. It's an important time. Thank you.